Good morning, colleagues. I see there's two attendees that have raised their hands. I'm not sure if there's any particular question that you would like answered before the session begins.
Good morning. Am I audible?
Good morning, Milani. Yes, you are audible.
Thank you very much.
Thanks.
Good morning, Leslie. Shall we go ahead and initiate the meeting?
Thanks, Prof. Sana. Good morning, colleagues, and welcome to the early access vaccine rollout for healthcare workers. It is 10:03. We're going to start with today's briefing session for healthcare workers on the Johnson & Johnson vaccine rollout. So before I hand over to Professor Leslie Banford, who will be chairing this morning's session on the briefing, I would like just to run through some housekeeping rules for this morning's session. So kindly note that the session is being recorded and proceedings will be shared with participants at the end of the session. Please ensure that your mic is always on mute to prevent any voice disruptions. If you have any questions, please use the question and answer icon to type your questions, and all questions will be addressed at the end of the session by the panel. A copy of the presentation will be made available to all participants online. It will be distributed via email. I'm going to hand over to Professor Leslie Banford, who will take us through this morning's session and welcome all participants. Thank you. Leslie?
Thank you, Shadrach, and good morning and welcome to all the participants. I see that we currently have approximately 1,300 people, and I think many people are still joining. But it's after 10 o'clock, so let's get started. So it really is a privilege and a pleasure to be hosting this webinar today. As most people are aware, we were able to start with our early access program for healthcare workers this week. There have been many changes and this program was implemented at short notice. And so we are aware that there has been some confusion and there are many questions from healthcare workers. So we're hoping that during the course of the morning, we can really provide everyone with the necessary information. We have a panel of excellent speakers, and we will then also have a chance to answer questions and concerns from the attendees. So I think without any further ado, we will move on to the presentations. So Professor Ian Sanna from Right to Care, together with Professor Amina Goga, will be taking us through and explaining the background and giving an overall view of the early access program to the J&J vaccine for healthcare workers. So thank you, and over to Ian, I think, is starting. Thank you.
Sorry, I think Amina is going to take the first presentation. Thanks, Professor Banford.
Okay, apologies for that. Amina, over to you.
Thanks very much, Leslie, and thanks everybody. Welcome. It's a pleasure to be here today. I'm just going to share my presentation. So just tell me when you can see it. Tell me when you can see it.
We can see it now. Yes, thank you.
And do you see it in the current mode?
Now
yes,
it's perfect,
correct.
Amina.
Okay, okay, sure. Thanks. So thanks everyone. I'm going to take you through the Sisonke Early Access Vaccine rollout for healthcare workers. I hope you can hear me clearly. And I'm going to start by just reminding us of the waves that we've had in South Africa. So we've had increased number of cases in wave 1. We've had a more severe wave 2. And what we really want to do now is to avoid severe wave 3 and particularly avoid increased infections and death amongst healthcare workers. As you know, we've had several vaccines on the market for COVID-19, and 3 of them have been tested in South Africa. You have the Oxford AstraZeneca vaccine, the J&J vaccine, and the Novavax vaccine. The one that we are currently rolling out is I think someone has muted me.
You're
Hello,
unmuted
do you
now.
still hear
Your
me?
background noise
Okay.
is quite. Yeah,
Yes,
your
my
background noise
noise
is
is
quite
a
high.
lot.
Close
Yes.
the door or something.
I'm
But
going to
please
see if
keep
I
going.
can just close the door. Thank you very much. I'm just going to ask someone to close one of the doors.
So while Amina's doing that, she's actually is running the Steve Biko site at same.
Thanks so much. I hope that's better. So the one that we're talking about now is the J&J vaccine. As you can see, it's based on an Ad26 human adenovirus platform, and the vaccine was tested in the USA, Brazil, and South Africa. I'm going to now give you a bit more detail about the J&J vaccine. So the J&J vaccine was tested through a study called the Ensemble study. This was a multi-center study. It was a phase 3 study, and so what that means is that it was set up to determine the effectiveness of the vaccine. The sample size was large, and it was set up to test effectiveness in a clinical research setting. It was a double-blind study, so neither the participant nor the investigator knew whether they were getting vaccine or placebo, and there was a one-to-one randomization, meaning that you either got vaccine or placebo in a one-to-one ratio. It's a single-dose regimen, so only one dose of the vaccine is given for this regimen. As I said before, the vaccine is based on an Ad26 platform, which is a human adenovirus platform, which is a platform that we know from vaccinations that have already been developed in the past. It's been used in the Ebola vaccine, RSV, in Zika, and in numerous HIV vaccine trials. The vaccine is stable at 2 to 8 degrees Celsius. So now just telling you a little bit about the age distribution of people who enrolled in the Ensemble study. So approximately 44, almost 45,000 people were enrolled in the Ensemble study. The age distribution was, sorry, it's just getting noisier here and I'm trying to find the quietest spot. The age distribution, as you can see, there were quite a few people above the age of 60. And that was because the study was deliberately set up in this way so that we could assess the effectiveness and the immune responses in not just younger people, but in older people as well. The gender distribution was 45% males and 45% females and 55% males. And as you see, the study was distributed across the USA, Central and South America, and South Africa. The study also made an attempt to enroll people with comorbidities. And here you see the distribution. So 41% of the study population had obesity, 7.3% had type 2 diabetes, 10% had hypertension, and 2.8% had HIV. There were also other immunocompromised participants in the study. So here you see the results of the study. As you see, the vaccine has a 57% protection against moderate to severe COVID, 85% protection against severe COVID, and 100% protection against death. In terms of the safety profile, the vaccine does have an acceptable safety profile, but there are common reactogenicity events, but there have been no severe safety signals and no anaphylaxis. And just to say that the Ad26 vector has been given to more than 200,000 people across the world. J&J have now applied for emergency use for the vaccine, and in South Africa, there's a rolling submission with SAPRA. So now let's focus on the current study, which is the Esonke Early Access Program. As with all studies, this has a primary objective, which is to assess the effectiveness of the Ad26 vaccine on severe COVID hospitalizations and deaths in healthcare workers compared with the general unvaccinated population. Then there are several secondary objectives, including to assess the incidence of symptomatic and severe SARS-CoV-2 infections amongst vaccinated healthcare workers, to look at genetic diversity, and then to look at pharmacovigilance to monitor for safety and unexpected side effects. So why is the vaccine being introduced in a research setting? Well, we know from the phase 3 study that it's safe and effective. It's awaiting registration, which might take a few weeks or months. We have identified that healthcare workers are a priority population for health workers, and we'd like to protect health workers during the third wave. So SAPRA has approved the use of the J&J vaccine in a phase 3B open label study. That means that it's in the period while we're waiting for registration. It's open label because everyone gets vaccine, nobody gets placebo. And so that's why it's a phase 3B open label study. People have to register to be part of this, and there's the website at the bottom. So in a nutshell, the vaccine is safe. It just has reactogenicity side effects, no anaphylaxis reported. It's effective, easy to roll out, but not yet licensed. And so we're going for a phase 3B open label study. But we're also piggybacking it onto the government's 3-phase rollout, where phase 1 was to focus on healthcare workers in the public and private sectors. And so as part of phase 1, the Sisonke Early Access Program is the very beginning of this phase 1 rollout. And this phase 1 rollout is being done through a phase 3B open label study. So vaccine has arrived in South Africa from Belgium on the 16th of February, quite a momentous occasion. It has been distributed from Johannesburg to all provinces. And then we started vaccination on Wednesday. So there are a few steps for healthcare workers that everyone must please take note of. One is to register on the EVDS. This is compulsory. If you do not have a voucher, if somebody does not have a voucher, they cannot be vaccinated. So please register on the EVDS, respond to the SMS invite for early access, provide consent to take part, receive the vaccination voucher, and only then come to a vaccination center. We're having quite a few people still coming to the vaccination centers without vouchers, and it's frustrating for them because they have to wait. They've got to register, and it takes sometimes an hour, sometimes 2 or 3 hours. For managers, what you need to know is that we expect 300 to 500,000 doses in the next 2 months. We've received the first batch of 80,000 doses, which have been distributed across 17 sites across the country. We're focused on large hospitals that have a high number of staff who have been affected by COVID-19, and the site or the hospital is in close proximity to a research site so that we can store the vaccine and the cold chain can be maintained. What do we need? We need vaccinators to administer the vaccine. We need pharmacists, and we have research staff. Private sector staff have been coming to hospitals as from today to receive their vaccination, and I'm at Steve Biko at the moment. It's a wonderful collaboration. And just to remind us that a third of the doses in batch 1 are meant for the private sector. We have identified provincial research leads, research leads, and private sector leads, and encourage everybody to communicate so that we set up these systems in provinces. And then just to explain that these are the research sites that are responsible for the study, because these were the ensemble research sites in South Africa. There are 31 research sites. 16 of them have been identified as primary distribution sites for batch 1. And 17 public sector hospitals have been identified for rollout during batch 1, and these are some of them. And they're attached, each hospital is attached to a research site. How does the system work? I think you'll get more details about this just now, so I'll just say very quickly, you have to register. There are 3 steps. You register on the EVDS, you have to go through your consent, and once you do that, you get another link and you go and determine whether you're eligible to receive the vaccine, and only after that do you get a voucher. Only once you have a voucher should you proceed to the vaccination center. Sorry. So this is just to say what happens at the vaccination center. There's a flow. We're trying to refine the flow as much as possible. You go through a registration. You then go and double check that you have a voucher, that everything's in place. You then proceed to the vaccination room. We're trying to do real-time data capturing. You get the vaccine from the pharmacy. Remember that the vaccine has to be drawn up, so you may have to wait a while. Once you've been vaccinated, that's captured on the system, and we're trying to do all of this electronically. Then you move to an observation area where you are observed for 15 minutes. We remind you of some of the side effects, which are the reactogenicity side effects. And then after you're done with your 15 minutes, you may leave. You then receive a message to say that, yes, you have been vaccinated. There is a safety number that you can call, and we do talk to you about some of the expected reactogenicity effects. So just to say that we have started on Wednesday, uptake is increasing. We have had some challenges, but we have been addressing them. We need more advocacy. What we've realized is that lots of people don't know what we're doing and that this vaccine is available. We have been struggling with computers and the internet, but we've gotten better, almost 100% better since Wednesday. Just a reminder about registering on the EVDS, and we are still trying to get rosters going in all 9 provinces to ensure staff availability over the weekend. So this is just a poster that we've developed and that we've implemented at sites that we are putting up advertising the hot desk. If anybody does have any reactogenicity effects, there's also a REDCap database that's been created, and everyone who's vaccinated gets a link reminding them of some of the common reactogenicity effects of what they should do. And if they experience anything, they can click onto this REDCap link and fill out a form. They're also welcome to call the safety number, or they're welcome to come back to the site. This is where we are so far. So as you can see, we've started in most of the provinces and we've vaccinated 5,301 people so far. This is the SMS that goes out to everybody who's vaccinated with the REDCap link down below and the hot desk number. And these are just some pictures from the vaccination sites in Johannesburg. So thank you very much. Leslie, over to you.
Thank you very much, Amina. Can we move on to the next presentation? Ian, I believe you are taking us through the next presentation. Is that correct?
No, I've managed to ask the very busy Melanie Vormerans to take on the next presentation. Thanks.
Okay. So thank you very much to Amina. So Amina is one of the co-PIs on the study and has been working very actively with us and also managing the Steve Biko site. So thank you very much for taking time out of what sounds like a very busy morning at Steve Biko to join us. Thank you very much. The next presentation then will be provided by Ms. Melanie Vormerans, who has also been extremely busy. Melanie works with us in the National Department of Health and has been the person responsible for the development and implementation of the EVDS, the Electronic Vaccine Data System. So without any further ado, Melanie, over to you. Thank you very much.
Good morning. Thank you for the introductions. Am I audible?
We can hear you, Melanie, and we can see your slides. Thank you very much.
Thank you very much. Thank you very much for the opportunity to share with you our electronic data system, which started going live on Wednesday with the first vaccinations. Went through quite a number of processes, listening to the inputs from everybody throughout the country, and are adapting as we move forward in order to ensure that it supports the vaccination program. So just to have an indication that we do have the electronic vaccination data system, and some of you might have been in part of the webinars where we actually have presented that to you. And then with the Sesonke program, we had to add a component which is specifically related to the e-consent component. And I'm going to carefully just take you through this process so that we all have the same understanding. This slide is just giving a summary, and it's indicating the processes of the communication through an SMS with all healthcare workers at this stage. So the process starts with a self-registration on the National Department of Health EVDS self-registration portal. I am sure that most of you have already been exposed to this, and it starts with that. Then there is a sequencing of identifying individuals that would be getting their SMSs to be invited to participate in the, or to receive the Sesonke or to be participating in the Sesonke program. This includes then where you need to go onto the research protocol in order to provide your e-consent. And then you will receive a voucher. And after that, you go to the site with your voucher and your ID. The vaccination is captured on the system. Once they have captured this on the system, you will receive an SMS that confirms that you have received your vaccine. And together with that, you also receive a unique code, which is your unique code, which confirms that you have received this vaccine. And if at any stage we had to go back into the system to draw your record, we will be able to do that with that unique code. And it's important that you safely store that information. After that, because we are interested to know more about your experience, there is then some SMSs that you will get. A first one, which is about the self-monitoring, and the second one also around the self-monitoring in terms of common symptoms. So let me go into the details now. So in terms of the current process, like I've indicated, all healthcare workers needs to register onto the EVDS self-registration system, and this is the portal. If you have been identified to be eligible for the vaccine now, because we've got 80,000 doses at the moment, so there is some sequencing that's happening, then you will receive an SMS, and this is the SMS. The SMS will say, dear, and let's use me as an example. So it would say, dear Melanie Wolmerans, thank you for registering for the national vaccine rollout. The South African Medical Research Council and the National Department of Health are offering healthcare workers to access the J&J Sesonke vaccine program. This vaccine is safe and effective single-dose vaccine. To proceed and give consent, go to, and this is the URL that belongs to the Sesonke Research Group, where you then need to go and give a consent. Okay, so the first message, most of you should have received this by now. It will say, dear Melanie Wolmerans, you have successfully registered on the National Department of Health electronic vaccine data system on the 2nd of February, and you will be contacted via SMS regarding next steps. Or there has been an agreement with the private sector group, B4SA, who's coordinating the private healthcare workers, that they've got a beneficiary registry and that should be automatically uploaded onto the EVDS. So you will then receive this message, which indicates which organization has given us the data and what data has been uploaded, and you will have to contact your employer or this organization to get more information around your information that has been uploaded. Okay, so that's the self-registration, and this is managed by the National Department of Health. So then you will get your first message, and it's the same message that I have read before. Maybe let me just pause. So if you have not received any one of these two messages above, that means you are not registered on the EVDS self-registration system, and you need to register yourself on the web portal vaccine.enroll.health.za. Okay, so once you've received this message, then and you are eligible, you will receive the next message which will invite you to enter the Sesonke vaccine program. So this is the message. I've read it before. If you haven't received this specific message, that means that currently, just with the current dosages that's available, you are not eligible for the Sesonke program. And as more doses are coming available, more SMSs and more groups of people will receive their message of invitation. I think Amina has explained currently the focus of the implementation, and this program is directly related to that. Okay, so the next one is then for you, apologies, you then need to go onto the URL, this one here, the HTTP Sisonke SAMRC, and you need to use your ID to access, and I will take you through the steps just now for that. The third SMS that you then will receive, which it will state that, and this is to confirm that you have been successful on this Sisonke consent registration. And it says, "Dear Melanie Wolmerans, you have successfully enrolled into the Sisonke vaccine program. We look forward to welcoming you." And then it would say the name. Then what is your voucher number? And you need to bring your voucher along with your ID document or passport to the vaccination site. So for public healthcare workers, you need to contact your vaccine site, which is currently the 18 site, directly to schedule when you need to come for your vaccine. And a vaccination roster for private healthcare workers is through the individual hospital groups or with the GP organizations. Again, if you have not received this SMS, that means that you haven't completed the e-consent process. And then you will receive a message afterwards to say that you have received the vaccine. There are the self-monitoring messages, which Amina referred to, and that you will receive after the vaccination to say your well-being is important to us, continue to practice social distancing, wearing a mask and other preventative measures even after receiving the COVID-19 vaccine. And then you are being directed to a web link where you can report any symptoms, or if you have got confirmed COVID-19, or you can contact the safety desk at that number, which is a toll-free number. You will also receive a second SMS, which will say common symptoms after vaccination include the following: pain, swelling, and redness at the injection site. Fever, headache, tiredness, and other flu-like symptoms may occur. These symptoms usually last 1 to 2 days. Should these persist, please follow the web link. And again, there's the web link, or it can be reported at the safety desk. Right. So just in terms of the process, if you receive the invitation SMS, you need to have internet on any device: cell phone, laptop, tablet, desktop. You will need your ID number, and you will need general contact information, because these are what you need to capture. Cell phone number, and the correct cell phone number is very important, because this is where we will confirm that you have received your vaccine with your unique vaccination code, as well as communicating with you in terms of a follow-up if it is required. Also very important is the correct ID number. If you don't put in the correct ID number, you most probably will have to re-register on the EVDS self-registration. And it should take 2 to 3 minutes, even less, in order to complete the e-consent. It's very user-friendly. You can go back, you can move to the next step once you have done the first one. You can use the backspace button to delete or to replace any entries. All the questions on the e-consent are compulsory, and only yes responses will allow to proceed to the next screen. And we are requesting that you complete it in one sitting. So if you start, complete it, don't start and go out, because it will not save your previous information. So this is the landing page of the Sisonke Research portal. You need to complete your ID number. And if you are a person eligible for the specific round of the vaccines, then it will take you to the next page. So if you are not eligible for the specific round of vaccine, this is the message that you will receive. And it will basically indicate that for the specific one, you might not be eligible, or you have not registered on the self-registration portal and you need to go back to the self-registration portal. Okay. Once you have just I need to go one. One of the key things, the first thing that you need to do is to look at the download the Sisonke participant information leaflet and info. You need to read through this. This is just the Sisonke leaflet. It will tell you everything about the vaccine and the program. And this is on your landing page. So this is the first step. Once you've read through that, you will then need to complete your details. Very important is to make sure that it is the correct cell phone number. You will click to say that your details are correct. And then you need to answer the questions that is on the e-consent. And as indicated before, there are 6 questions. Each question you need to give a yes answer in order to be able to proceed to the next process. There are the next process is just so that you read the terms and conditions. Once you've clicked conditions, you click submit. Okay. Then within a few minutes, we are timing it at the moment. In the beginning, it was a little bit long, but now it's between 15 and 20 minutes. You will receive your final SMS after you've done the submission, and you receive the screen on your computer or your tablet or your cell phone. Then you will receive the message to say, "Dear Melanie Wolmerans, you have successfully enrolled into the Sisonke vaccine program. We look forward to welcoming registration and vaccine voucher." They will give you a vaccine voucher. I see there's a wording here. I think it's the copy and paste. Apologies for that. And then you need to bring your ID and this voucher to the vaccine site, and then gives an indication of what the next steps are. At the vaccination site, in terms of the EVDS, this is now where we are capturing the vaccination process. So the first step is that there's an administration desk. You go to the administration desk with your ID and your vaccination voucher. I just want to confirm that most of your personal details would have been drawn from the self-registration. Your vaccination voucher should also be on the system already. And it's just to confirm your details and also to ensure and confirm identification. And therefore, it's important that you bring a form of identification with you to the vaccination site. The system will accept the green ID book. The system will accept a driver's license. The system will accept a smart card. It will accept a passport, and also some of our refugee and work permit. Even if you don't have any of these identity form of identity documentation, we have also made provision for an affidavit from the HR unit that confirms your identity and your identity number. So the voucher is confirming your eligibility, and that then gets confirmed on the system. In order to do this process, takes less than a minute if you have followed the process that I have indicated before. After this process, you will go and to the vaccination vaccinator in terms of the vaccine, where the vaccine will be administered. The vaccinator then has got the clinical obligation to explain to you, and this is done through the specifically for the Janssen vaccine from Johnson & Johnson. The vaccinator will ask key questions, and then you answer those questions. After that, you'll get the jab, and the vaccinator will indicate on the system that you have received your vaccine, your SMS indicating that you have received your vaccine, and this is your unique vaccination code. And that's the whole process of capturing this vaccination program onto the EVDS and Sisonke program. Thank you.
Thank you very much, Milani. I can see in the chat, I think there are a lot of questions around the EVDS, but thank you for that very clear presentation. I hope that has at least answered most of the questions, although I suspect that there will be additional questions. So now really, thank you to the presenters. And we are going to open up the webinar for questions. Shadrach, I believe that you are going to be facilitating the panel discussion. Is that correct?
Yeah, I'll just be handling the Q&A session, Prof. Bamford, and just read out the questions to the panel and just engage and get the responses from them.
Okay.
So we have questions in the chat box.
So, Dr. Bamford, can I maybe suggest a couple of comments just from a panelist point of view?
Okay, certainly. Let us then hand over to the panelists for their comments, and then we will take some of the questions. Ian, would you like to start?
Yes, so
Can you
I think,
introduce yourself and explain how you're involved in the program?
yes, certainly. So I'm Professor Ian Zanna. I'm an infectious diseases professor at Wits University. I have under my leadership one of the ensemble research sites at Hill and Joseph Hospital. In addition, I am the CEO of Right to Care, and I am supporting the Sisonke program with funding support from USAID to run the safety desk call center in particular, but also to assist the team, the leadership team, in developing the rollout of the Sisonke program, including the data management areas in particular. So, Dr. Bamford, I would like, I find it amazing that we have 2,000 participants on this call. It just shows how enthusiastic everybody is to, in fact, learn more about this program. I think we need to manage people's expectations a little, in that everybody feels like these 80,000 doses that we have in the country at the moment are the only vaccine that's going to come. And I wish to reassure everyone that these are not the last vaccines, that indeed the second shipment of vaccines is likely to reach us exactly 14 days after the first one, which means the 2nd of March. And then this is a progressive increase in number of vaccines up to 500,000. I think that everybody needs to understand that once registered through the EVDS, that registration does not go away and is linked to the ID number. There's just a helicopter overhead, sorry. Okay, so the next point I'd like to make is that the principle we would like to get across to everybody is no voucher, no vaccine. In other words, the only mechanism, calling your friends, asking somebody else to register for you, is not going to work. The only way is to register through the EVDS, and only people in pools of eligibility will become, the second SMS will become available to those people. And then they need to go through the e-consent process to get a vaccine voucher. Don't get the vaccine voucher, don't come to the site. Please do your vaccine voucher before you come to the vaccine site, because the team at the vaccine site are responsible for actually actioning the vaccination. We also encouraging all sites that participate to use the data system, because only then at the vaccine site, only then will we be able to have a complete record of who has been vaccinated, and in particular with which vaccine. So this Johnson & Johnson vaccination at the moment is a limited 500,000 doses, but the Department of Health, under the leadership of the Minister, are in the process of procuring other vaccines. And these will predictably go through the same process that we are going now. So we ask everybody who's completed vaccination to become an advocate for us, to let other healthcare workers understand the process, support them through the registration, and support them through the entire process to vaccination. We have got call center support for the program. We are listing those numbers progressively, so people can phone in to ask for assistance with the EVDS. And so in principle, we're trying to build a program that's going to be much bigger than just the 18 sites that are open at present. And there will be additional sites coming out at the beginning of March. So I hope that I've encouraged people to really buy into this process, and please do not panic if you're not eligible this week. There will be progressive rollout and increasing pools of eligibility over the next couple of weeks. Thanks, Dr. Bamford.
Thanks very much, Ian. I think that's very helpful. And there seem to be a lot of questions. So maybe just two issues to explain from the department's point of view. I think this may have partially been explained, but just to reiterate it, so that I think people understand that we had a rollout plan for the AstraZeneca vaccine that was unfortunately put on hold. And within that vaccine rollout plan, we would have activated a large number of sites simultaneously in both the public and the private sectors. So unfortunately, when that rollout was paused, initially we faced a situation of not having any vaccines. So we are very grateful that we have now been able to collaborate with the MRC and the ensemble sites to implement the Sisonke Early Access Program. However, it has come, there are some important differences. And the first one, as just explained, is that there are fewer sites, at least currently. So we have a total of 17 sites that were activated during the week. These are mostly, as people are aware, these are the large public sector hospitals. The sites were chosen for two reasons: because they were large hospitals, so we could access large numbers of healthcare workers as quickly as possible, and because they were close to the research sites, who as part of this process need to be supervising certain aspects of the program, particularly with regards to managing the importation, the distribution, the storage of the vaccine up to the point where the vaccine is drawn into the syringes. The vaccines are then handed over to our vaccinators in the vaccination sites. And from that point on, the rollout, the process continues as had been planned under the first rollout. But that limiting factor has been that each site needs to be supported by one of the MRC ensemble study teams. So as indicated, we will, after the first 2 weeks, move on to additional sites. These will both be additional public sector hospitals, and we will also, during that second round, start introducing, have vaccination sites in private sector hospitals. In the interim, arrangements have been made with the private sector, and that includes arrangements with both the private hospital sector and the private and general practitioners. And people in the private sector have been sent vouchers so that they can come and participate in the program in the public sector hospitals. In a number of sites around the country, the sites are open today and tomorrow. Unfortunately, in some sites, it was not possible to open the sites over this weekend. So we do ask for patience. People who received vouchers will be able to access vaccination at those sites during the coming weeks. But some of the sites are not open over the weekend. I think about half the sites are open and other sites are closed for this weekend. But as I say, we'll be offering vaccination to people in the private sector who have received vouchers during the course of the next 2 weeks. Amina, are you with us? And is there anything you would like to add?
I am here, Leslie. No, I'm just going through the questions in the chat and I'm just trying to answer some of them. But I think what you've said is absolutely correct. We've just started on Wednesday and I think we're trying our best to set up all the systems. It does take a while, but I must say from my own experience, it gets better every day. So I think, yeah, if you're not sure, there have been a few questions about the cooler boxes. As far as I know, it doesn't need to be WHO approved, but you do have to maintain a cold chain and you do have to have documentation of that. Leslie, I think I'll stop there, but if you want to go through all the questions, then we can. I'm not sure, but over to you, Leslie.
Okay, so there are a lot of questions. Some of the questions, and maybe Amina, if you could answer this, relate to pregnancy and breastfeeding. Could you just take us through whether pregnant and breastfeeding women can participate in the program?
Yeah, so the current guidance is that not pregnant women or not anyone who might become pregnant over the next 3 months. So we're excluding them. They may not participate. But breastfeeding, the vaccine has not really been shown to be dangerous in people who are breastfeeding. And so we are vaccinating people who are breastfeeding, obviously, if they consent as well.
So just to follow up on that, so my understanding is that we don't know. So it certainly is true that pregnant women unfortunately cannot receive the vaccine at the moment. But if someone does inadvertently receive the vaccine when they are pregnant, we can reassure them that we have no indication that the vaccine is not safe. But they should be followed up very carefully and registered on a pregnancy register. Is that correct?
That is true, Leslie. Yeah, that is true. And just to say that the platform upon which this vaccine is based, the Ad26 platform, has been used previously. And so we don't anticipate any adverse effects in women who are pregnant, but we would like to monitor. If you do inadvertently become pregnant or you didn't know when you took the vaccine, then please let us know so that we can measure the outcome. But if you do know that you are pregnant or if you're planning a pregnancy in the next 3 months, we're just out of caution saying we'd prefer not to vaccinate you at this stage. I think, Leslie, the other point I'd really like to make is about allergies and anaphylaxis. And if you can please let us know beforehand, because that's really important so that we know that we need to take extra care if we do vaccinate you, or so that we know that we should not vaccinate you. So please just make that clear. We have had a few people come here who've told us, and we have vaccinated one person who has had a history of allergy, and he seemed to be fine afterwards. Obviously, we had medical staff nearby. But if you have had severe reactions, we did have someone today who's had a severe reaction who came to talk to us previously to a vaccination. So please make your healthcare provider aware of that before they vaccinate you. We normally say that if you've had severe reactions, it's an exclusionary criteria. And so that's why we need to know.
Amina, there are some questions here about who's eligible to be on the study, and a specific question about whether people who are HIV infected can participate in the program.
Yeah, so the eligibility is 18 years and older. The second criteria is you must be a health worker working in the public or private health sector in South Africa. And then obviously you need to have gone through all the material, and you need to be comfortable. You need to know that this is a study. And I think those are the main criteria. I'm just looking to see the other criteria. So if there are others that I did not remember, Leslie, I'll come back to you now. But I think those are the biggest criteria that we look at. And then obviously exclusionary criteria are, if you've had any allergic reaction to any of the products in any vaccine recently, or if you've had any anaphylaxis recently, those are some of the exclusionary criteria, or anaphylaxis in relation to a vaccine. Those are exclusionary criteria. HIV is not an exclusion criteria. In fact, in the J&J trial across the world and in South Africa, there were HIV positive people who participated in the vaccination, and it was all fine. So yeah, and so Leslie, just to come back to the inclusion criteria, it is the two that I told you, 18 years and older, health workers in the private or public sector. It doesn't have to be a doctor or nurse. We also have cleaners who work in the COVID wards, mortuary staff. And so it's the healthcare worker is defined broadly. It's not just a doctor or a nurse. Whoever works in a hospital who's at risk of getting COVID, including cleaning staff, mortuary workers, because they are at a high risk as well. And you must be willing and available to participate in the study, and you must give consent.
Just
Leslie,
one more quick. Sorry, Ian. Yes, you can come in.
So we are, we haven't finally put this out as communication, but we are concerned about persons who've had severe COVID and been hospitalized, and recommend that at minimum a delay of 1 month post-hospitalization is in place. And we would ask those individuals to highlight that they've been hospitalized with COVID to the vaccinator before being vaccinated. Thanks, Dr. Bamford.
Thanks very much. I'm picking up some other questions that there seem to be quite a few people asking, and perhaps if Melanie can answer this. And the question relates to why people are asked for their medical aid details when they register.
Okay, can I indicate?
Yes, please go ahead.
Okay, so first of all, the self-registration part is for enrollment into the vaccination program in its totality. So it's not enrolling into the J&J program. And all medical aids has made the COVID-19 vaccine a prescribed medical benefit. And it's we need to get the details to also inform the medical aids of their members that has received the vaccination. And therefore it's to get all the information, because we will still need to vaccinate using other vaccines or as the program unfolds. and therefore the requirement for the medical aid details. Leslie, I don't know if you want to add just in terms of the reimbursement process.
Yes, no. So I think you've answered the question, Milani. That so this vaccine is donated, so there are no costs associated with receiving the vaccine. However, as Milani has indicated, in subsequent parts of the vaccine rollout, there is an expectation that medical aids will reimburse the state for the cost of the vaccine. That will happen in the background. So the vaccine will be free at the point of service delivery. But as I said, there will be a process of reimbursement, and that's the reason why people are requested to supply their medical aid details. Shadrach, are there any questions that you've identified that you'd like us to answer, the panel to answer?
Yeah, and I think this is for Prof. Ian Sana. I think he answered it in one of the sessions we had in the week. And Prof, the question for you is, if one has COVID, after how long would they be able to take the vaccine?
Yeah, so that's the same answer that we have at present, which is those individuals that had severe COVID and were hospitalized need to inform their vaccinators, and their vaccine should be delayed by a minimum of 1 month. We are at the moment asking the vaccine MAC, the Vaccine Advisory Group, to give us an indication of what the recommendation should be for those who had mild or moderate COVID. But at this time, we would like to delay a vaccination for those individuals who had severe COVID, particularly in the second wave. Shadrach, I think that's the answer.
Yes, thank you so much, Prof. And I think a question for Milani is a number of people are having challenges in receiving the SMSs after registration. How do we provide troubleshooting solutions to this? We've received a number of questions on this item.
I'll try and answer, and Prof. Sani can add, so I'll start off. One is that it depends on what SMS you have received. So everybody is referring to the SMS that they have received to say they've been registered. So therefore they have opted in to receive a vaccination, right? So in order to be able to get into the Sonke program, you need to receive your second SMS, which indicates that you have been invited to participate in the program, and you need to go to the sisonke.samrc.ac.za website, where you need to complete the e-consent. If you haven't completed the e-consent, you will not receive a voucher. If you haven't received the voucher, you cannot go to the vaccination site. And that's the process. So it depends on what SMS individuals are referring to. Having received an SMS confirming that you've registered on the National Department of Health EVDS self-registration doesn't mean that you are currently at this moment eligible for the J&J vaccine. But as has been indicated by Prof. Sani, these are being expanded. So it's not that this is the only vaccine, and if you're not in the line now and you don't receive your message now, that you won't get vaccinated. It gets expanded as capacity is being improved. Ian, I don't know if you want to add anything to this.
Yes, absolutely. So you know, our attendees need to realize that we built this program in 16 days. We had to start with a group of people that we could reach easily, and therefore focused on the individuals at the site level. We have got expanding eligibility lists being developed and loaded. So there were 20,000 healthcare workers from the private sector loaded last night in collaboration with HASA, and 5,000 GPs loaded in collaboration with the GP networks. We have a request from 2 provinces to open up the entire district of healthcare workers, and a third one that came in this morning. We are managing this in a progressive way to make sure that the capacity that we have at the vaccine sites does not get overwhelmed. We anticipate a doubling of sites within the next 2 weeks, and then we anticipate a further doubling of sites in the following 2 weeks. So essentially, if you are not receiving the Sisonke second SMS at this time, it means that the portal has not been opened to include your group specifically. We ask you to be patient. This is going to be progressive as we open sites. It takes quite a lot of effort to ensure that the right staff, the right equipment, and the vaccine is available at every site. Please understand that this program will expand, and it will go to the millions of doses that the National Department of Health is committed to procuring. I also would like to emphasize that this is a healthcare worker program at the moment. This is the phase 1 of the rollout, and the Department of Health will be expanding this into other populations in the big phase 2. And then there was a specific question on veterinary or animal health folks being eligible at this time. And I think that's not the case. At this time, we're focused on those healthcare workers that are treating and dealing with COVID at the coalface. There were very specific questions from individuals around if they've registered, but they haven't received the second SMS. I would reiterate that depends on whether the pools have been opened, and it depends on the vaccine site capacity. We did over 6,800 vaccinations yesterday. We anticipate to reach 10,000 per day. So your turn will come. Thanks, Dr. Bamford.
Leslie, can I just add to the numbers?
Yeah, Melanie, sure.
We've sent out 36,000 invite SMSs to public sector healthcare workers.
Okay, and approximately 30,000 to private sector healthcare workers, is that right?
20,000 in total, okay, of which 5,000 is the GPs.
Okay, thanks, Melanie. So there's a question here that I would like to pick up on. The question is, I'm going to read it. It seems like a trial, or in brackets research, is running concurrently with the vaccination program. Is there going to be some placebo given to some people with the vaccination program for research purposes?
So I can take...
Leslie, I can take that question.
Yeah. Okay, sure. Over to you, Amina.
Yeah, so you're right that what we're doing now is an early access program through a phase 3B open label trial. And I think 3B means that we're just waiting. We're in the hiatus now between the time that we know the vaccine is effective and that it has to be registered. So in that hiatus, we're doing this through a phase 3B open access study. So it's the beginning of rollout, but through a phase 3B open access study. Are anybody or is anybody receiving placebo? No. It's an open label study. Everybody's receiving vaccine. Everybody's getting a syringe with vaccine in it. There is absolutely no placebo. We have done that phase of the study so far. I see a message in the chat bar to say, do you have SAPRA approval? Yes, we do. Everything has been through SAPRA. It managed to go through quite quickly because we had done the ensemble study, which is this phase 3 trial testing the J&J vaccine in South Africa. We had 31 research sites set up in South Africa to do the ensemble study, which tested the J&J vaccine. And so we put in that all these research sites are part of the the study, and that's why every hospital is linked to a research site, and you have research staff working with hospital staff to administer not to administer, but to administer this whole early rollout access program. And so, yes, it has gone through SAPRA. We've addressed all SAPRA's questions, and it has gone through the ethics committees that all the research sites are attached to. So all that has been taken care of.
Leslie, can I add?
Oh, okay.
Over to Ian, yes.
So there was a question which we can address as well, and that was, does this study have clinical trial insurance? And it does. So untoward, unexpected adverse events that occur due to the vaccine are covered by insurance. However, the actual COVID disease outcomes are not covered by insurance. So to be clear that if the vaccine causes trouble, best possible medical care will be provided to somebody who has been vaccinated. Thanks, Dr. Bamford.
Thanks very much. And perhaps a linked question. There have been concerns raised that this vaccine is not going through the quality assurance process. I think people were very well informed and kept track step by step of how the AstraZeneca vaccine moved, and know that the vaccine was quarantined and subjected to testing by the National Control Laboratory before it was released. Amina, maybe if you could you just explain why there's a different process for this vaccine and a little bit about that process?
Okay, thanks, Leslie. I'll start, and then maybe Ian wants to add as well. So the doses that we've managed to get for the early access program are doses that were developed for research. So they were meant to be used in research studies, such as the Ensemble study. And so when we realized that there would be this hiatus in South Africa because we didn't have a vaccine to roll out, we collaborated or corresponded and had lots of discussions with J&J. And they then realized that they did have batches of vaccine that were developed for research purposes. And so they got together all their research batches around the world, put them together, and then offered them to us. So they're coming into the country as part of the batch that would have been used for the research studies because the research study would have continued for a while longer if we hadn't met the endpoints earlier. But we met the endpoints of the research study earlier. So this is the Ensemble study. And so these were then produced for that, and they are now able to come to us directly so that we can use this in the next stage, which is the phase 3B open label study. Ian, I think you may want to add to my answer.
Yeah, so the quality assurance certification was actually undertaken before the shipment was sent from Europe, and those certificates were submitted to SAPRA. That meant that we did not have to do the quarantine and testing in South Africa. So you can be assured that it has been quality tested and approved. It was just that we had the benefit of certification that came with the shipment. Thanks.
Okay, thanks to Ian and to Amina for answering those questions. There is a lot of anxiety amongst healthcare workers, and some of this anxiety seems to be linked to the notion of this being a study or a clinical trial, etc., and concerns that people are, the phrase that's usually used is that they're being used as guinea pigs. And I think one of the purposes of this webinar is really to give people information to reassure them that this is not the case, and hopefully to equip them to provide accurate information to others around them. So thank you very much for those answers. Shadrach, are there some questions that you would like to pose to the panel?
Yes, I think linked to the Ensemble study, I just there's a question in the chat box that wants to find out in terms of the efficacy of the vaccine in reference to the 501 variant. If maybe Prof. Goga can just answer that question for us in terms of the efficacy studies on this particular vaccine for the 501 variant?
Yeah, thanks, Shadrach. So I think as it happened that when we were doing the ensemble study last year between September and December, it was the 501 YV2 variant that was circulating. And so most of the endpoints accumulated in South Africa were with the 501 YV2 variant. I think it was more than 98% of those that were tested with endpoints had the variant. So the vaccine has been tested against the variant and was found to have been 57% effective. So unlike other vaccines, this is the first vaccine where we have real life data from real people, so patients who participated on the study, that shows effectiveness. It was not based, this measurement was not based on pseudovirus in the laboratory. It's based on real virus, on real people with endpoints. So I hope that helps. I don't know if anyone wants to add. Ian, do you want to add?
Yes, so the breakdown is 57% reduction in or viral effectiveness in preventing infection. That was lower than the overall study vaccine effectiveness, sorry, which was 83%. But really, really, really important is that this study, the ensemble study, was large enough with over 40,000, I think it was 44,000 participants, that to show us that there was an 85% reduction in hospitalization or severe disease, and that nobody died who had received the vaccine. So the important part of this early access program is to confirm that that is still the case in a much larger population. We therefore are going to be monitoring all vaccine participants for any COVID diagnosis and for any hospitalization. We will be using the well-represented NICD laboratory database and the well-discussed DATCOV database to in fact verify if any participants do in fact have COVID at some point in time, and whether those individuals actually are hospitalized. That follow-up will continue for 2 years after the first vaccination. So this is really, I think, a breakthrough, because this particular study, the ensemble study, was the only study conducted in our setting to show at enough size, with enough participants, to show that we could reduce severe disease, hospitalization, and avoid death completely. Thanks.
I think a follow-up question to you,
Yes.
Prof, for jumping in, Leslie, is what is the clinical management in terms of asymptomatic clients regarding vaccines? Are we going to be administering vaccines to asymptomatic clients?
Yeah, so by definition, asymptomatic means it was a random diagnosis conducted for some other reason, and people didn't have symptoms. And I think that we're very clear that those people should go forward for vaccination. If people who were diagnosed with mild to moderate symptoms, again, to reiterate, we're asking the vaccine MAC to give us guidance, to come out with one national statement. And then those who had severe and life-threatening or severe and hospitalized COVID, at this time, my personal recommendation as an infectious diseases doctor, that there should be at least a 1-month delay between the end of hospitalization and vaccination. Thanks, Cedric.
And Shadrach and Ian, I've just put up the slide. I'm not sure if everybody can see, showing the points that Ian was speaking to and that I mentioned earlier about the 57% protection against moderate to severe COVID, 85% protection against severe, and 100% protection against death. And I think the last two, sorry if it's getting noisier here where I am, the last two are very important, especially for healthcare workers.
So the laughter in the background, Amina, means that people at the vaccine sites are very happy. Because,
yes, Ian, they are very excited and taking photographs. So
Shadrach, do you have a question that you'd like us to answer?
I think, Prof, I think we need to just handle the training issues around the administrators. A lot of people are saying that vaccination has started at their sites, but they have not been trained. So maybe if we can touch on the training issues in terms of the process for training vaccinators.
So you mean the vaccinators? So
Yes.
so everyone who is vaccinating should have been trained. The training is available on the Department of Health's Knowledge Hub and can be downloaded. In addition, we have trained master trainers, and they should be providing face-to-face training for vaccinators. So remember that this was part of the preparation for the first rollout, and when we were expecting to activate a large number of vaccination sites. So vaccinators really should have completed their training. And if they have not, then they should be in touch with people at their site manager. It may be the case that because as things turned out, we ended up activating fewer sites. We did require more vaccinators at those sites than had necessarily been anticipated. So it is possible that there are a few people who haven't been trained, but the training is available, and they need to liaise with, as I say, with their facility vaccination manager or the provincial vaccination manager to make sure that they do complete the training. I haven't seen the latest figures, but I know last weekend already about 10,000 vaccinators had been trained. So the vaccination training is available, and people should access it via the Department of Health Knowledge Hub. Thanks very much. Back to you, Shadrach.
Thank you so much, Prof. So we've answered a number of questions, but I think the one that keeps coming up in terms of immunosuppression, the efficacy on that. I'm not sure if Prof. Ian or Prof. Gogo will be able to answer that question.
So I've been trying to answer some chat questions as we're going. Those that are very personalized, I am giving a personal response. In general, so the most important risk factors in South Africa include diabetes, hypertension, age, and HIV. We have data for all of those and recommend that healthcare workers living with any of those conditions, including age, I'm smiling for age, have got are eligible for vaccination. There were then a couple of very specific questions with very specific clinical situations that I would recommend that individuals on immunosuppressants in renal failure or that have polyneuropathies or transverse myelitis, that those individuals need to speak to their doctors before deciding whether to go ahead with vaccination. In particular, I have an individual clinical case that has been described to me of a person who is taking immunosuppressants for lupus. And I think that is going to need to be the patient-doctor relationship, their clinician, to determine whether they should go ahead and vaccinate. From our perspective, eligibility will be permitted, and the decision to consent and take the vaccine is up to the individual. At every site, there is a doctor, and so if those questions have not been resolved or cannot be resolved by the vaccinator, then the site level doctor will make the determination as to whether the vaccine should go ahead or not. Shadrach, over to you.
Thank you so much, Prof. And I think one of the questions that we should address here, it's the programmatic management of adverse events following immunization. Dr. Bamford, can we just give an overview in terms of how we monitor side effects, reporting, recording it in terms of this entire vaccine rollout? Thank you.
So let me talk a little bit from the Department of Health perspective, and then perhaps Ian or Amina can add. So from our perspective, within our immunization program, we have always had a program or a process for reporting what we call adverse events following immunization. That where these are identified, there's a case recording form that should be completed, and then that should be sent to a central address, which as far as I remember is aefi@health.org.za or health.gov.za. And that process will continue. There is then all of those adverse events are, well, if necessary, are investigated further, particularly if they've been serious, and then are reviewed by our National Immunization Safety Expert Committee. So from our side, that process will continue. We will be sharing information with our MRC colleagues. So as I understand the system, as soon as we receive information that will be shared with our MRC colleagues, and likewise, where they are identifying and following up adverse events, they will be shared with us. We have, this is obviously a requirement from the SAHPRA side, that there are robust systems for following up adverse events following immunization. So we're looking at this really for the whole vaccine rollout program. We've put these systems are already in place, but we do know that we will anticipate much higher volumes of adverse events because we will be vaccinating such large numbers of people. So there is a process of strengthening these systems to follow up all adverse events, to track them, and also to be able to respond very actively and urgently if there are any patterns that are emerging that suggest that there are any safety concerns with the vaccines. So that's from our side, and perhaps one of the other, Ian or Amina, would like to add to that. Over.
Yeah, so no, I think that you have described it perfectly. I would say that the integration between the Sosonke team collecting this data and SAHPRA has occurred, and we're working on essentially one system. The collation of those reports is done in every second week. We are obliged to submit reports to SAHPRA every second week. And the systems are laid out that if there is a severe event that occurs, it will be fully investigated. We anticipate that this vaccine is safe and effective, and therefore, at this time, even one serious adverse event would cause us to investigate it 100% and immediately. And then the mild, to reiterate also that mild symptoms are not necessarily adverse events. The vaccine, to react, the immune system has to have some way of showing that it's reacting, and those are called vaccine reactions, and those are actually good. So not every single muscle pain and reaction at the injection site is an adverse event. It may actually be just showing that the immune system is responding to the vaccine. Thanks, Dr. Bamford.
Thanks very much. There are some questions
Sorry,
here.
Leslie.
Oh, Amina, would you like to come in? Yes.
No, I just want to say that in the chat bar, I'm just putting together the email addresses for the adverse events. I'm just going to type in the safety number, and I'm also going to put in, there's a website that you can go online to report any adverse events as well. But what Ian has said, I completely agree with. So just keep an eye on the chat bar. I'm just putting that in now.
Thanks very much for those responses. I'm going to come in with a question here. There are a few questions. I'm going to read this one. Is one restricted to any form of physical activity or activities, e.g. exercising or sexual activity before or after receiving the vaccines? There have also been questions if people can go back to work straight after being vaccinated. Amina, could you answer those, or Ian?
I can start, Leslie, and maybe Ian can add. So I think every person reacts separately to the vaccine. Some people do have no effects, they experience nothing, and others experience some of the reactogenicity effects. So I would say that it is an individualized decision. And in terms of going back to work, some people are absolutely fine on the day of vaccination and the next day. So it really is an individualized decision depending on how your body reacts to the vaccine. Some people have chosen to take prophylactic paracetamol. It's not what we recommend in the protocol, but we do say that if you do have any of the reactogenicity effects, you're welcome to take paracetamol or similar painkiller. Ian, I think you may want to add from your ID perspective.
Yeah, so I do think that reactions are individualized. I think that if anybody who has fever should not be exercising. So any temperature over 37.5 degrees, I would recommend delaying exercise until the temperature has been normal for at least 3 days. And then in terms of the other thing that I'd like to highlight is we do try and emphasize that our women participants who are vaccinated, we ask to avoid pregnancy for 3 months after vaccination. And apart from that, I think it's very individual. I don't think we make a blanket statement on work. We need our healthcare workers at the coalface, so we ask you to, do this thing judiciously. If you do feel properly sick and have a high fever, which does sometimes occur, then clearly it's a day's sick leave. This should not last more than 1 to 2 days. If it lasts more than that, we ask you to call the call center so that we can take things further. Thank you very much.
Thanks, Ian. Back to you, Shadrach. Do you have any questions you'd like us to answer?
Sure, Prof. I've got two questions, but let's start with the first one. So they're asking in terms of can they access consent forms, information for participants, brochures, or manuals in capturing forms, if we can provide them with a link of accessing those forms. But a question for Amina. In a language we can all understand, what does it mean when you say that the J&J has 100% against death, and how was this measured during the trial? And can you tell us a little bit about Sisonke? What entity are they? What do they do? And more importantly, what role are they playing in this vaccination work? And this is from Gauteng.
Okay, thanks so much. So what it says is that you saw the figures 57, 85, and 100. So what it's saying is that if you take 100 people who have received the vaccine, and sorry, it's getting noisier here. So if you take 100 people who have gotten the vaccine and you compare them to 100 people who have not gotten the vaccine, no one who had received the vaccine and got COVID had died. If you take 100 people, we have prevented 15 people against severe hospitalization when they've had COVID by using the vaccine. And if you take 100 people, we have prevented, so it's 100 minus 57, we have prevented, 57 people who against moderate to severe disease by giving them the vaccine. So I think I made a mistake with the middle one. If you take 100 people, we have prevented 85 of them from getting severe disease because of the vaccine. So only 15 of them got severe disease, whereas without the vaccine, all 100 of them may have gotten severe disease. So we have done those preventions by giving them the vaccine, trying to present that in simple language. I hope it's clearer. And then the answer about Sisonke. So Sisonke is not an organization. It's not a pharmaceutical company. It's not a research company. It's just a name that we chose as we were trying to embark on this early access program. It just means together. And so we said that we would like to do this initiative together. It needs partnership between various sectors, research organizations, the National Department of Health, provincial departments of health. And so we're all coming together to make sure that this early access program takes off so that we can protect healthcare workers before the third wave. So that's what it is. So it's not an organization, it's just a branding for this initiative, which is an early access initiative. It's not owned by anybody, it's just us as researchers and government getting together to say, let's call this something, and we're calling it together Sisonke. I hope that's clear. Ian, as part of the team, would you like to add anything, or anyone from the Department of Health?
I think that was perfect. The SAMRC are the sponsors of this program, which means they were the applicants to SAPRA and to the ethics committees. So, but in principle, Sisonke together, and there's large groups of people, both at national and provincial level, working on this program. Thanks.
And Ian, do you want to add anything on the explanations to the 57, 85, and 100?
Yeah, so this becomes very difficult, but it basically shows that, as Amina said, that we managed to reduce the number of infections by 57 out of 100. We managed to reduce the number of severe infections by 85 out of 100. And there were no deaths in those individuals who were vaccinated. So it's important that this is a safe and very effective vaccine that can now be given to a larger group of people. Our target is 500,000. Thanks.
Thanks, Ian, for that. And I think linked to that, what does it mean when one is vaccinated in terms of immunity, population immunity? Is it a guarantee that once I get vaccinated that we sort of like contribute to the immunity? Maybe if you can expand on that.
So I can take that. So I think that it is an individual level protection. It is not a community protection. We do anticipate and have seen in Israel, the United States, France, Germany, that the more vaccinations that are undertaken, the less the number of new COVID infections are. But we still recommend social distancing to ensure that we go through this phase where we're expanding vaccines without any further outbreaks in the community. Thanks.
Thank you so much. Just to the first question that I was asked in terms of the resources that are required, consent form, participation manuals, how can clinicians on the ground access these documents? Is there a link where they can access consent form, or is it a provincial or a national level distribution?
Shall I try that?
Okay, Ian, yeah, go for it.
Okay, so so remember the motto: no consent, no voucher. So the only way to actually get onto the program and sign consent is to actually go through the EVDS. No consent, no voucher means no voucher, no vaccine. So the process needs to be followed by every individual down the line. And then the actual the program description and participant information leaflet or information sheet can be made available. I don't think it's posted on an open website at this time, but we'll arrange that during the week and let people know that in communication. But at the moment, the individual has to register has to go through the information leaflet themselves, need to sign that on their cell phones, giving an e-consent, and only then will a voucher be issued for the vaccination. Thanks.
Thank you so much. Prof. Benford, I'm going to hand back over to you. We've answered a number of questions, and I think what we've decided as well is to establish a frequently asked questions with a number of questions that have been proposed here, and we will get the team to answer those questions and we will circulate it out. So I'm going to hand over back to you, Prof, and then maybe we can just take a few comments from the panel. Thank you so much.
Okay, thanks very much. Perhaps one last question to the panelists. So someone was asking in the chat, what about the second dose of Johnson & Johnson, the J&J vaccine? So just to be clear that the J&J vaccine is a single dose vaccine. So once you have been vaccinated, it's just one dose, and then you will be protected. There are questions, though, and perhaps Ian could answer this, about whether people will need to be vaccinated again in the future. How long do we anticipate that protection from the vaccine will last? Ian?
So vaccines have only really become available in the last 3 months. The clinical studies have been ongoing for a bit longer than that. I think we have confident data for 3 months that the vaccine immunity, both antibody and cell immunity, lasts at least 3 months. The participants in ensemble study will be followed for 2 years with interim testing of that immunity. We do expect it to last a protracted period, but the sort of public statement one can make at the moment is 3 months. And should we see that revaccination is necessary, then that will be planned. I think that everyone needs to realize that this is probably going to be like influenza, where we have to vaccinate annually, also to cover the changes that the virus may be undergoing. So I think healthcare workers can expect to need to be vaccinated once a year. Thanks.
Okay, thank you. But unknown at present, so we will have to wait and see. Thank you, Ian. Milani, there have been a lot of questions about the EVDS and the registration process that I'm hoping were answered during your presentation. Are there any comments that you would like to make?
Thank you, Leslie. I also attempted, I think I answered about 50 questions on the Q&A. So if participants can also go and look at those. Just to say, one, if you have registered on the EVDS, the National Department of Health EVDS, at the portal vaccine.enroll.health.za, you do not have to re-register because your record will be on the system. Like I've indicated before, this is what we will use even if additional vaccines become available. And also just to indicate that we appreciate feedback because it allows us to improve the flow of the system. We want to make sure that we can vaccinate as many as possible people or individuals, also making sure that we comply with all the regulatory requirements. And therefore, we are trying to run the system as efficiently as possible to support everybody. Thank you.
Thanks very much, Milani. There's quite a few questions about the private sector. I think we have answered those. While we've been on this webinar, the person who's coordinating the private hospital sector vaccination tried to phone me. I didn't take her call, but she has sent a message that she was phoning to give positive feedback about what's happening. So it sounds as if the system is up and running in a number of provinces and private sector healthcare workers are being vaccinated. We know there have been problems in some provinces, but we do have a commitment from those provinces that systems will be put in place within the next week or so to allow private sector people who are eligible and have been issued with vaccines to be vaccinated. And I think, to reiterate what Ian was saying, a request for patience. This is a complicated program. We are working very hard to reach as many people as quickly as possible, but some people are a little bit further down the queue than others. Ian, I think we are coming to a point where we'll be wrapping up. Are there any last points that you would like to make?
I'm happy with your summary. Thanks, Dr. Bamford.
Amina, anything from your side?
No, nothing. Thanks so much, Leslie. Thanks for the opportunity and looking forward to moving this forward.
Thanks very much. And I think, Amina, we know that you're working at Steve Biko Hospital today, and I think we do want to just extend our thanks to you and all the other vaccinators, healthcare workers, administrators, doctors who are now working over the weekend to ensure that as many people can be vaccinated as possible. So I think on that note, thank you very much to the presenters. We have noted all the questions. I know we didn't answer all the questions, but I think we will also use them as indicated by Shadrach to identify some frequently asked questions and to make those available to people. So we trust that this has been informative, that we have managed to answer many questions, and we would encourage people to be vaccinated, to advocate for vaccinations, but at the same time, please just to be patient and to take into consideration the fact that we are vaccinating as fast as we can. We are committed to increasing the number of vaccination sites, but it is going to take a little while before everyone who wants to be vaccinated can be vaccinated. So thank you very much for your participation. And enjoy the rest of the weekend. Thank you also very much to Shadrach for setting up the webinar and for assisting with facilitating. Thank you very much, everyone. Goodbye.
Thank you. Bye.